reflected in the latest unemployment figures. Despite our constrained economic environment, we are encouraged by a number of recent investments in our province, which include the following: the Nyanza light metal, which is the construction of the first phase of the Nyanza light metal titanium dioxide, which is a pigment production plant, which commenced in March of this year. That investment is valued at about 4.5 billion. Secondly, the Wilma processing, the construction of the 1.3 billion crude vegetable oil refinery, which is a facility that is being constructed in Richards Bay Industrial Development Zone, commenced in October 2020. Currently, civil engineering work are underway at the site. Once completed, the facility is set to create 202 jobs. You will remember that we visited Pepco Logistic Facility, which is a 1.5 billion facility at the Keystone Business Park in Hammersdale. We launched this on the 11th of May this year. Construction of this facility is currently underway, and once operational, the facility will create 2,200 jobs. You will know also of the DeFi Warehousing and Distribution Center. And on the 19th May, DeFi South Africa officially opened a 170 million warehousing and distribution center in Ladysmith. The facility has the capacity of loading in excess of 200 trucks per day and a storage capacity of 100,000 cubic meters. It will create 130 new jobs. The business processing outsourcing, this is a call center. The growth of the business processing sector has been phenomenal. About 15,000 jobs have already been created, with the potential for a further 55,000 in the medium term. We have spoken about the Durban port expansion, which will see about 100 billion invested over the medium term in terms of ensuring that Durban port is expanded, reduction of congestion, and increasing capacity of the port. Some of you participated also in the signing of the Memorandum of Understanding between KwaZulu-Natal government and the African Bank, which is the Africa Export and Import Bank. This Pan-African Development Financier, which is headquartered in Cairo, in Egypt, is already funding some of the projects in our country and our province, such as Nyanza light metal. This MOU will see a new era of investment in the province, which is highlighted by the 20 billion worth of projects which have been presented for consideration for the funding by the bank. All of these developments are warmly welcomed and extremely encouraged. They are like a bandage that will heal the wounds of unemployment and the loss of livelihood that have been as a result of COVID-19. We are quite concerned about the recent development in the Richards Bay minerals. We want to condemn in strongest terms the recent incidents of killings and arson at the Richards Bay mineral. As government, we are committed to working with all stakeholders to bring stability in this important economic belt of the province. We have full confidence in the capacity of our law enforcement agencies to bring to justice all those ringleaders behind the economic sabotage that is taking place in and around Richards Bay. On Thursday this week, the Mineral and Energy Minister, Minister Gwede Mantashe, together with a delegation from the provincial government, visited the area to pay respect following the death of one of the senior manager, Nico Swart, who was killed in a very, very brutal way. We continue to send a message to all members of the community to play their role in safeguarding that investment, which is quite critical in the creation of jobs. If RBM collapses, it is people's livelihood that will be severely affected. Let us expose the criminals that are involved in this and rise up against all those who are destabilizing our economy, especially at such a critical time. Coming back to the purpose of today, although there is always room for improvement, we must say that we are quite pleased with how the rate of vaccination has been proceeding in the province. From our 124 vaccination sites so far that we have created, and 18 in the private sector, we have managed to vaccinate a total of 360,451 people in the province. This is made up of 237,195 senior citizens who are above 60 and 123,256 healthcare workers. KwaZulu-Natal Department of Health will be opening a further 21 new vaccination sites this week. And this will be to accommodate educators who will be getting vaccinated from the 9th of June, which is this coming Wednesday. We will be receiving about 11,000. No, I'm sorry, we will be receiving about 110,400 J&J vaccines for this category. We already have a database for these educators which should be vaccinated as the process starts on Thursday. These educators will be guided by the management in their respective districts and circuits regarding which sites to go to in order to get vaccinated. Some districts will also open new sites where sites do not already exist, while others will have to designate their own existing site accordingly to accommodate teachers. We are also exploring the possibility of opening these vaccination sites over weekends because educators work between Monday and Friday. We are also concerned by a few schools which have reported high number of infections within a space of few days. For an example, on Friday, the 4th of June, one school under Umzinyati reported 16 positive cases of learners. Another school under the Utugela district reported 15 positive cases of learners. The Department of Education will continue to implement COVID-19 protocol and to provide necessary PPEs. With regard to the status quo when it comes to COVID-19, the latest information we've gathered over the past 24 hours is that KwaZulu-Natal has recorded 227 cases, bringing the total number of confirmed COVID-19 cases to 340,586. Sadly, we have lost about 10,534 people as the province. The province of KwaZulu-Natal continues to observe an increase in the number of new cases recorded weekly, and that is very concerning. The overall percentage change in the number of new cases between week 21 and week 22 was 24%. The actual number of new cases were 726 for week 21 and 900 for week 22, respectively. Amajuba district is the only district that has reached alert line, and cases have been slightly increasing in the 3 previous weeks. eThekwini has also been receiving the highest number of cases, although it has not reached the alert line. eThekwini continues to contribute the highest percentage of deaths, which is about 36% of the total deaths. And in terms of numbers of those who die at home, it's also worrying because 2% of these 36 are home deaths. The median age for death was 63 years. More than half of the deceased were females, which is about 54%. We continue also to see recoveries, and recovery stands at 325,295, and active cases are at 4,163. We will present you with a clear detail on the figures per district, but maybe what one can highlight is that in eThekwini right now, the total number of cases stands at 160,241, and the number of deaths is about 3,849. The total number of cases, as I've said, in KwaZulu-Natal stands at 339,992. The total number of deaths, as I said earlier, is 10,534. Now, this tells you of the picture, and if we break this per district, you will see that in terms of active cases, eThekwini it's at 0.7%, Ilembe 1.4%, Umgungundlovu 1%, Uthukela 0.9%, King Citshwayo 0.3%, Ugu 3%, Amajuba it's 1%, Umkhanyakude 0.1%, Hirikwala 6%, Zululand 4%, Umzinyathi 2.7%, and unallocated is 0.1%. So the active cases in KwaZulu-Natal as a whole stands at 1.2%. Many people have been asking whether the province is in the 3rd wave or not. The answer is that at this stage, we will say no. But in terms of our emergency early warning site, a 10% increase in cases over a 7-day moving average will trigger an alert, while a 20% increase in cases over a 7-day moving average will trigger a resurgence, which may indicate that we are entering a 3rd wave of COVID-19 infections. So we continue to monitor trends and signals of resurgence in the province. Our focus is on identifying clusters and conducting targeted testing in the affected areas, identifying and strengthening contact tracing, intensifying our risk communication drive with an emphasis on non-pharmaceutical interventions. Our strategy to deal with the potential third wave stands on the following pillars: testing all COVID-19 suspected cases and their contact, isolation of confirmed cases, monitoring of those who are self-isolating, tracing all contacts of the confirmed cases, dedicating beds for quarantine and isolation as well as ICU, ensuring oxygen availability, accelerating vaccination. So this is the totality of the plan to cap the third wave. In conclusion, our main focus now is to accelerate vaccination and stay highly prepared should a third wave hit us. We are calling on techno-savvy citizens to assist with registration of our elderly and the rural poor. We have directed that all MEC champions, mayors, and Operation Sugumasake war rooms dedicate a week in their respective districts and ward to monitor and facilitate registration for vaccines. Each one must register and each one must take vaccine. Even though our province has not entered the third wave of COVID-19, we should nevertheless remain vigilant and acutely aware of the potential risk of a resurgence of infections. We cannot overemphasize this. It is crucial for us to adhere to the non-pharmaceutical interventions such as wearing of masks, maintaining social distancing, and washing our hands regularly with soap and water or use sanitizer. Our memories are still fresh and we have barely recovered from the tragic episodes of the first and the second waves. It is now proven that individual behavior, such as getting into large gatherings and crowded spaces, spreads the virus fast and it moves quickly among many people. We urge all citizens to adhere to the level 2 regulations, which are indeed and are intended to keep us out of the third wave. Let us continue to limit our movements. The vaccine is safe, and therefore we call on all people to register, including the fact that the walk-ins are accepted, and when people come in, they get registered, and then they get vaccination. If your turn has come and you have been notified, please go and get vaccinated, because this is our only hope to stop the spread of the virus and save lives. It is up to you and I to ensure that the relatively low number of infections that we are currently seeing, though it is increasing, should not escalate. It is up to us to ensure that we curb the spread and not hit the storm. Let us save the day by doing what is right, and all of us should adhere to non-pharmaceutical measures and go to vaccinate when our turn comes. I thank you.
Thank you very much, without any further, I'm going to open for the questions from the colleagues that are here in the room. I'll take an indication if there are colleagues that want to ask questions from the online platform. I'll start with the colleagues here. We have three hands, starting with you, Mrs. Lane, colleague here, and Sheila. So you introduce yourself and then do want to start.
Okay, I think my voice is loud enough. More Michael Lane from News in Africa. Premier, I'm interested to know as to, we're not the third wave yet, but you might be going there. Is there a way of study from the previous waves of how you can minimize the impact of that? Because we've talked about the lives lost and the economy, that we don't go back again to a devastating situation and also levels being have to raise of the lockdown. And then MEC, for you also, in terms of the rollout, you're seeing now that there's an issue with the minister is embroiled in the scandal with Digital Vibes. Are you concerned anywhere that maybe if he were to lose his job or something, that might impact the way that the province gets its vaccines from the department also? Might that have an impact in how KwaZulu-Natal communicates with the National Department of Health? And then number two, we have some experts who say that we might be already in the third wave because they're analyzing sewer situations. Have you seen that? Are you communicating with them to try to understand as to how they got to that conclusion, seeing that you are already saying that we're not there yet, but we might be heading there? Thank you.
Tabiso Koba from The Witness. I just have two questions for the Health MEC. Just the first question, I'm curious. The Premier said that more females than males have died. I can understand if you don't have the answer right now, but I'm just curious. Is there sort of any reason why disproportionately more females than males have died from COVID-19? And my second question is regarding the vaccination sites. I think, we've all seen in the media that there are some vaccination sites for old people where there was a lot of crowding and it could have been unsafe. What is the department sort of doing to make, vaccination sites not turn into, places where people can actually just, contract the virus, especially as we move on to the next stage?
Thank you. Next one.
ukuthi njengoba othisha bezothola ukuthi bagome kuleli hlandla lamanje, mhlawumbe kuzobe kubhekwa othisha mhlawumbe abanezifo vele ezibahluphayo, noma kuzobe kubhekwa nje bonke nje othisha ukuthi bathole umgomo?
Okay. Chris, my name is Vusi Kumalo from SABC News. The Premier said that there's more than 123,000 healthcare workers who have been vaccinated in the from the phase 1 category. As far as we know, the target should have been completed by end of May of vaccinating all or almost all the healthcare workers. So what were the problems that led to government not being able to complete or to hit that target? And also, are you confident that the current phase 2, are you going to be able to complete your target by September?
Okay, thank you very much. Any from one? Okay, I will hand over to the Honorable Premier.
I think the MEC can start. It's better.
Thank you very much. Good afternoon, Premier. Good afternoon to the colleagues. Thank you very much for the opportunity. Maybe, Premier, let me start with the last question from Uvusi, which was saying we had a target that we have put in place for ourselves, and we have not been able to vaccinate the total number of our health workers, and it is correct. We've not been able to do so for a number of reasons. The first one is that it's not all the health workers that are willing to take the vaccination. As a result, we have had to follow some of them and try and get them to buy into the idea of vaccinating. Understanding that we have always insisted and have always indicated that vaccination, no one is going to be compelled to take the vaccination, but we mobilize and want people to do so of their own volition. So where health workers have not been willing to take the vaccination, we have not been able to force them to take the vaccination. That is the first issue that affects us. But the second one was the availability of the vaccines themselves. We were not able to receive the total amount as and when we needed it for us to be able to conclude the health workers that we needed to vaccinate. But now we have then, we are starting to move. But the third factor is that the health workers in the private sector in particular, when we started opening, we had a challenge in that some of those that are running private practices were beginning to register their families as if they are employed within their own practices. For instance, you then have a doctor that come with a wife who, according to the system, is registered as an administrator, and one of the sons and the daughters would be registered as a PA and or someone who works within the factory. As a result, the national department, in about 14 days ago, then decided to close down the system that had registered the health workers, because they needed to deal with that issue. It's not an issue that was just happening in the province, but it's a problem that was happening nationwide. So all of that affected our targets. However, we are sure that by the end of June we would have completed all the health workers that are willing to be vaccinated, because those that are not willing, we are unable to actually force them. So those have been some of our challenges that we were faced with when it comes to the vaccination of health workers. But I must indicate that there are other facilities that have actually, we would say, have reached their maximum. I'd give you an example. Letandi Hospital, they've reached 98% of vaccination of health workers, and the 2% are only those that have not been willing to come forward. Of course, there are engagements there, but like I said, we will never be able to actually force them. So, Ubonga, your question is that is there anything that we can do to minimize the impacts of the third wave? Look, the point that the Premier is raising, and it's something that all of us need to speak to our communities about, is to ensure that we continue to adhere to the non-pharmaceutical interventions, which means that we continue to wear our mask, we continue to wash our hands, and we continue to maintain social distancing. I must indicate that within the last week we received a report from the Justice Cluster that was indicating that in other areas some events coordinators have begun to mobilize or organize events that would have more than 1,900 people and so forth. And in that meeting, we agreed that if that continues unabated, it means we are certainly setting ourselves up for a third wave. And there is no way you can maintain social distancing when you have 1,700 people in one space. So we agreed with Emi Nkonyeni, who's leader of the Justice Cluster, that the security cluster will ensure that regulations are implemented. So we call on our people, particularly young people who are beginning to attend these events, to stay away for now. I mean, we know that it is very restrictive, but it is in the best interest of all of us, because young people often will get infected, but they will not get sick. But once they go home and they get to the elderly and those that have comorbidities, then those will get sick and be affected adversely. So we are making a call to young people to ensure that they actually stick to that. But we have also taken a decision that the security cluster must be very harsh on the event organizers who are organizing these events, because they are deliberately going against what the law says, and we said the law must take its course. So we are calling on our people not to attend, but we are saying the security cluster must implement what needs to be done in relation to that. So what can we do to make sure that we are not in the third wave? Really, it's just maintain the non-pharmaceutical intervention so that we are able to stay away from that. Your second question, look, our interaction with national government as a province is not based on who is the minister or who is the deputy minister. We interact and engage with the national office based on the law, based on the constitution, on what is the role of a provincial government and what is the role of the national government. So the interaction that we have between ourselves as national is always based on that. It actually has no standing or has no linkage with who is the minister at any given time. The number of vaccines or the kind of treatment that we have received as a province, it was not based on the fact that Dr. Mkhize is the minister, but it has been based on the fact that the province is the second largest in the country. So when you distribute vaccines, for example, you distribute according to that. So we would obviously be the second behind Gauteng, because Gauteng has the highest population so far. So are we in the third wave? In the third wave, we are not. The Premier was just reading now, how would we define ourselves? At what point would we then be able to say we are in the third wave? And one of the triggers, or one of the indications that are there, is that a particular number, 10% of the infections rate within the past 10 days is what is looked at. So if within 7 days, not 10 days, 7 days, if within 7 days you go over 10%, it means you are reaching your alert level line. But if you go beyond 20%, it means you are reaching your resurgence line. We are not anywhere near those two as a province. Of course, there are a few districts that from week to week it looks sometimes like they are about to reach the alert level line, but they don't actually reach there. For this week, it was indicated that only one district looks as if it's reaching that alert level line. So at this point, as a province, we have not reached the third wave, or we are not in the third wave. Why are there more females than males that have been affected? In fact, I think we are speaking in relation to deaths in particular. But in terms of infections generally, we see that females are more infected and affected than the males. So when you use a pedestrian mentality, you would use a mentality that says, because as a province we have a higher population of females than that of males. But we don't want to use a pedestrian mentality. We need to be scientific in our approach. Right now we have requested a number of our scientists to actually look at that matter for us, because right from the beginning of the first wave we did notice that our numbers are not in proportion. But you find that you have more females than you do have males. So they are working on that particular research, and as soon as the scientists have been able to give us the report, I suppose we will make it available for everyone to understand. Are our sites safe as the province of KwaZulu-Natal when it comes to vaccination in particular? They certainly are. We have made sure that there is always social distancing. We have made sure that the elderly or the over 60 who come to our facilities do not interact in a manner that jeopardizes their safety and their lives. I know that, Premier, the question is being asked because there is one political party that decided to issue a statement about a week or so ago indicating that at Clearwood in particular there was no social distancing. It's not true. It's not true, because the different vaccinating sites, as Premier was indicating, that the members of the Executive Council have been tasked to go to districts where they are champions, have been visiting the different.
Oh, it's a pity that we lost that link, but you got the gist with regards to the state of play in KwaZulu-Natal. You heard from the Premier earlier on, giving us an overall look of where they are in terms of the numbers as well as the vaccination drive as well. So total number of cases in KwaZulu-Natal is 339,000, over 339,000. Total number of fatalities over 10,500. Active cases, the Premier said, is 1.2%, and I think he's referring to in terms of the national figures as well. So at this stage, the Premier says at this stage, the province is not in a third wave. But there's a caveat here. He says that there are indications that the province is entering in a third wave. So the main focus is to accelerate the vaccinations in the province. We will hear much more. We will try to get that link back up. The health MEC in KwaZulu-Natal was addressing the media there. So stand by for that. All right, other news happening on our watch this afternoon.